What do we need from the shoulders in the golf swing? Okay, in the golf swing, backside shoulder, what we need here is to get into external rotation and some abduction or abduction. What that looks like is we need the shoulder to be able to do this, and we need it to be able to do this. From the front side shoulder, what we need here is for the shoulder to be able to adduct, and we need flexion and internal rotation. So what that looks like there is we need the shoulder to be able to come across the body, we need it to be able to internally rotate, and we need some flexion.
Okay, when we're testing clients and patients at Integrated Rehab and Performance Center, again, with our golfers, we really want to look for these different mobility aspects, right? So with that lead side shoulder, in this case, my left arm, again, we're looking for shoulder adduction and shoulder internal rotation and flexion. So here we're testing that adduction, the ability for that arm to come across the body. Obviously, really important. Now, it's much easier. We really need to do this with a clinician who is holding and pinning that scap down so we can see how much true shoulder adduction is coming from that shoulder joint and is not coming from compensation of maybe a protraction or a forward protrusion there of the scap and other compensations, right? So typically, most people are very limited in this motion actually, and it leads to all sorts of compensations throughout the golf swing, right? So in this case, we pin that shoulder blade down, and then we see how far we can come across to the midline there. Here for shoulder internal rotation, again, same thing. Much easier done passively with a clinician. Again, we're looking to see how far can we get that hand towards the ground without that shoulder starting to pop off the ground. Again, we want to see about 60 degrees there at least, and then shoulder flexion, we're just bringing that arm up overhead, and we're seeing how far can we get it before we start to see either a rib flare or other compensations like elbow bend and different things at the shoulder. So there I'm demonstrating that rib flare where we would stop the test right where we start to see that happening. Again, we like to see about 180 degrees, 170 degrees of shoulder flexion overhead. But again, to get true shoulder flexion, a lot of people are actually very limited when it comes to true non-compensatory shoulder flexion, where we're not getting any help from any other joints. Now this backside arm, we want to look at shoulder external rotation. We can see that happening here. Again, we want to stop once that shoulder starts to come off the ground, and we start to change that angle or the plane of the arm out to the side there at 90 degrees of abduction. And we're looking for 90 degrees of external rotation there. Again, really important to be able to achieve a good top of the backswing position, especially when we're working on certain drills that are asking us to kind of drop into that slot. Again, if we don't have shoulder external rotation, it's going to be very difficult to make that happen without compensating elsewhere. And then the last thing, we are just looking at shoulder abduction, and this is easier done on the edge of the table there. And all these we'd really do with a clinician, doing it passively, so the patient just kind of has to hang out there, and we move them through this motion, and we stop when we start to see the different compensations coming up. In this case, usually it's when that sternum starts to turn towards the arm as we're moving there, just like that as I demonstrate there. And we're looking for at least about 45 degrees shoulder abduction, and again, not surprising, lots of people are limited in this range of motion here.
So how are golfers getting into the backswing if they're so limited in a lot of this range of motion? That being lead side adduction, lead side internal rotation, and backside external rotation. Well, they're compensating through other joints. So they'll do anything to make it feel like they're in the backswing, at the top of the backswing, make it anything to look like up here we're in the top of the backswing, when in reality, what we're doing is we're losing our angles here at the ankles, knees, and hips. We're using extra thoracic rotation if we got it, but again, most golfers don't actually, they usually don't have enough. So what they're doing again is just shooting their hips forward, and then they're doing anything just to get what feels like a good top of the backswing here. But then we've lost all our angles elsewhere, and now we're chunking balls, we're slicing balls, and all sort of swing characteristics start to come out of this, again, because we want to feel like we're at the top of the backswing, but our shoulders are not letting us get there without compensating elsewhere.